Yes, thank you so much, and good morning, everyone, and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the Heart of Georgia region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the Project Manager for this plan, and I want to thank you all for attending this morning. Just a few virtual meeting housekeeping items. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or a smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have scheduled breaks for questions and discussion. Please ask or provide a comment during the workshop. It's designed for us to better understand rural and human service transportation in your region, and your active participation is highly encouraged. When asking a question or making a comment during these times, please use the raised hand feature in Teams. This is the icon with the smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is the comment bubble icon. Our team member Jaquita will be monitoring the hand raises and chat box during the entire workshop. The 2050 Rural and Human Services Transportation Plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of a consultant team comprised of AECOM, Cambridge Systematics, and Model Mobility Partners. Today, we're going to run through the following topics. I will provide a brief introduction and some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in the Heart of Georgia region. After, Baird Breen from Cambridge Systematics will walk us through the region's transit needs. And then Kirsten Moat from Model Mobility Partners will guide our discussion session. We will also have a couple question and discussion points throughout the workshop today. So what exactly is rural and human service transportation? Not many people may be familiar with the terms. Rural and Human Service Transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. This 2050 RHST plan seeks to do a few things. First, we're going to do an update of the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from the first plan to identify projects, programs, and policies to meet current and future demands and provide enhancements to RHST services across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation, or NEMT. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency's system operates independently using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human services transportation, or to coordinate planning and funding of transit services for rural communities. A little bit of history on the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to that plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. The RHST Plan 2.0 outlined coordination activities among the rural public and human services transportation providers across the state to achieve improved service delivery for the state's public transportation and human services transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our planned schedule. You can see we wrapped up our vision and goals, which I will discuss on the next slide, and they're heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get your input from your region to help us understand needs and develop solutions. The stars in the schedule indicate stakeholder and public outreach events. Those with a pink circle indicate the Technical Advisory Group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, also includes representatives from the regional commissions, the Statewide Independent Living Council of Georgia, and other stakeholders identified during the stakeholder engagement process. We are engaging stakeholders and the public in each of the 12 regions in Georgia through these regional workshops. And again, thank you so much for attending this morning. We are also conducting a statewide survey for RHST providers and a separate survey for writers, the link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to assess the status of the RHST plan update and identify key needs and service coordination strategies. Additionally, public feedback will be elicited through the 30-day public review and comment period for the draft RHST plan update, which we are targeting for July. The RHST vision and goals are structured from the statewide transit plan. Our vision statement outlines where we would like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer from AECOM to walk us through the available transit in the Heart of Georgia region. Will?
Great. Thank you, Matt, and good morning, everyone. Thank you so much for taking the time to attend. As Matt mentioned, my name is Will Brewer, and I'd like to just take us through a few maps to talk about your existing transit systems and some of the support that DHS and DCH are providing to your region. So Heart of Georgia, as you can see, and I'll discuss this in detail in case there are a few of you that are calling in today. But we have 10 counties without transit, and we have approximately 7 counties with transit. So Bleckley, Dodge, Telfair, Wayne, Wheeler, Wilcox. From our research, we've been able to determine that they all provide rural demand response transit services. Lawrence County, I did want to point out, I believe that is a newer county within your region that does provide transit services. And Kirsten will go into more detail on what kind of verification that we'd like to get from you on that. 10 counties without transit: Emmanuel, Johnson, Troitland, Montgomery, Toombs, Tatnall, Evans, Appling, Jeff Davis, and Candler. Those would be those counties that do not have any transit services currently that we know of. Moving over to Human Services, DHS, there is coverage across the region for DHS services, and those come from different parties: Division of Aging, Division of Family and Children Services, and Department of Behavioral Health and Developmental Disabilities. So that's your current condition on DHS services within the region. Lastly, moving on to DCH, those non-emergency medical trips. Those trips for medical treatment, medical evaluations, obtaining prescription drugs, medical equipment, and so forth. The entire state of Georgia is operated with by 2 brokers, and there are 5 regions across the state. So it looks like your region does fall within 3 different DCH regions. That's Southwest, East, and Central. Mode of Care handles Southwest. Mode of Care also handles East, and Mode of Care handles Central. So Mode of Care is your primary broker throughout your region for DCH services. So just something to digest, and we're going to revisit these maps, and I'm going to hand over to Kirsten, and we can talk a little bit more about those services. Kirsten?
All right, thanks, Will. Yeah, so we want to take a break here and focus in on the existing transportation and services that exist today. So we have a little exercise for those that have access to a computer or smartphone. You can visit the website www.menti.com. That's MENTI.com. You can also do a snapshot of the QR code that is on the screen. And it's going to prompt you to a website, and it's going to ask for an 8-digit code. That 8-digit code is 63187458. For those that are joining us by telephone, if you do not have a computer in front of you, I'm going to ask the questions verbally, and while people are responding through the Mentimeter, if you would like to unmute your phone and provide a response verbally, we would welcome that. So I'm going to leave this up here for just a second. Again, that's menti.com, MENTI. When you get to the website, it's going to ask for a code, and it's going to be 63187458. The code will remain at the top of the screen for your reference. So let's jump in. So the first question that we have is based on the maps that Will just presented, and I'm going to reference back to them and I'll talk about them a little bit for those that are on the phone. What services are we missing? Or do we have any incorrect information about the services that are available in the heart of Georgia region? So what transportation services are missing? So maybe there is another public transit operator that's operating in one of the counties that we're not showing. Maybe there's some private transportation services being offered through nonprofits, maybe a faith-based organization who provides rides for a specific group of people. It could be seniors, it could be youths, it could be it could be for any group, but that would not be reflected in these maps. These are all services that are funded through different federal funding programs. So GDOT with the Rural Public Transit Service, DHS through their services, and Department of Community Health with the non-emergency medical transportation. So I'm going to go back to the maps. Feel free to enter it in. If you're on the phone, please feel free to unmute yourself and chime in. I've got the maps brought back up. So talking about the public transit, as Will mentioned, there are 7 counties that currently have some type of rural public transit service. We show that all of these are an on-demand service. So Bleckley, Lawrence, Dodge, Wheeler, Telfair, Wilcox, and Wayne counties. The remaining 10 counties, we do not believe have any sort of public transit services. Johnson, Emmanuel, Candler, Evans, Tatnall, Toombs, Appling, Jeff Davis, Montgomery, and Trutland. For human services, we're showing that there are senior transportation services, family and child services, transportation services, and Department of Behavioral Health and Developmental Disability Services across all counties in heart of Georgia. And then for the non-emergency medical, you are in 3 different regions, the Southwest, the East, and the Central, but all are operated by the same broker Mode of Care. Okay, so what transportation services are missing? We have one response. We need more advertisement for public transit. That's a great comment. Thank you so much. Um, I think this is something that we're hearing from other regions as well, is that while public transit service may be available, people either A, don't know that it exists, or B, don't know that they can use it. They think some people think that those transit services are just for disabled people or seniors, and they don't know that they can also book a ride and ride that bus. Okay, I'm going to move on to the next question. So thinking about the existing transportation services that are in the heart of Georgia region, what are some of the challenges or constraints that you're facing as a provider? Or what are some of the challenges to riding transit if you are a rider? So these could be things like we want to operate more days of the week, but we cannot. Or maybe it's more hours of the day we want to operate, but cannot. I think one of the examples we've heard from a couple of other regions is that the transportation operations end about 5 or 6 p.m. in the evening. But there is a high demand for third shift workers, especially in areas where you have manufacturing, industrial, distribution, and warehousing, where you have a workforce that is working that overnight or late night shift, and they don't have access to the transportation because of the service hours. Other constraints that we're hearing, labor shortages, driver shortages. Um, it's highly competitive for jobs right now, and competing between industries. So that's a constraint. Funding has always been a constraint. We need more funding. Another constraint that we've heard are shortages of vehicles or parts for vehicles. So having, this causes delays in your maintenance schedule because you're waiting on parts, or you've ordered vehicles or want to order vehicles, but there's a backlog, and shipments of those vehicles are being delayed. So anything like that, any constraints that you are facing. So again, if you're on the phone, please feel free to unmute yourself and chime in. If you are using the Mentimeter, please feel free to enter your responses. Alternatively, you can enter your responses through the chat feature. Or if you want to say something, please use the raise hand function in Teams, and Chiquita will call on you. So I'm not seeing any yet. I know there's got to be something that y'all are dealing with that's keeping you up at night. Okay, here's one. Find more funds so we can hire more drivers at a competitive pay rate. Think this is something universal. This is something that every region and almost every transportation provider is dealing with. Bear's going to talk a little bit more about what we're hearing from the survey. But I think the competitive pay rate is something that a lot of people are struggling with. And how do you find those funds? How do you cover that additional cost, and try to maintain your fares? So yeah, I think this is something that everyone is really feeling the pressure. Any other constraints? And I just want to reiterate, like, this is your opportunity to tell us what you need. We're going to be thinking through all of these needs, constraints, challenges, barriers, and coming up with specific projects, maybe some programs that can help you, and maybe some policies to provide more flexibility with your service. So your input now is going to help us understand what kind of solutions are available. I want you to keep thinking about these questions. We're going to have more opportunity for your input a little bit later in this presentation. We're going to take another break. I will say we're done with the polling exercise, so you can exit out of the Mentimeter. We have your responses recorded, so I appreciate your participation in that. I am going to now turn it over to Mr. Baird Breen with Cambridge Systematics. He's going to talk about the needs assessment and some of the quantitative and qualitative feedback that we've been receiving as far as the needs across the state. So, Baird?
Good morning, everyone. Thank you so much for your time today. Just want to talk about our needs assessment that we've been conducting and share some of the qualitative and quantitative findings that we've seen so far. So to start, the needs assessment approach that we used is consistent with the approach used by GDOT for its statewide transit plan that it conducted in 2019 and 2020. We wanted to be consistent in the methodology so that we could kind of make comparisons and see what had changed during that time period and try to adopt lessons learned where possible. Additionally, both methodologies are taken from a methodology produced by the Transit Cooperative Research Program, which is a national research center that identified this methodology as a best practice for evaluating rural transit demand. So we're confident in this methodology. We think it's pretty robust and reliable. It's been used across the country, and we're happy to be rolling it out here. Next slide, please. So this methodology consists primarily of, the quantitative component of the methodology consists primarily of two categories: a non-program demand assessment, which is highlighted in the table in blue, and mobility gap demand assessment, which is highlighted here in green. These two methodologies represent two different approaches to analyzing rural transit demand and essentially represent a lower bound and an upper bound, with the non-program demand assessment helping us set that minimum, and the mobility gap demand assessment helping us set that maximum. This essentially gives us a range of values to work with in terms of analyzing patterns of transit demand. The non-program demand assessment and the mobility gap demand assessment both base their analyses on demographics within rural regions of a county that are then aggregated up to the regional level. And essentially what they do is they look at the number of people that belong to transit dependent or transit reliant groups in order to make an estimate of overall transit demand. So for the non-program demand assessment, these demographic groups consist of people ages 60 and older, people with disabilities, and residents of zero vehicle households, by which we mean people who live in households where they do not have reliable and consistent access to a private vehicle. The mobility gap demand assessment takes a similar approach, but focuses in on one of those demographics and analyzes their travel behavior and uses that as the basis for transit demand. That mobility gap demand assessment calculates the difference in the number of trips between one vehicle households and zero vehicle households. So essentially it compares the travel behavior of those residents of households where they lack access to a vehicle compared to the travel behavior of residents who live in households that have access to a vehicle. And those and that difference in trips between those two categories forms the basis for analyzing rural and human services transportation demand. Now, both of those data sets rely on demographic information taken from the American Community Survey, which is a tool, or a survey tool conducted on an annual basis by the U.S. Census Bureau. However, since there's a lag in the release of data, essentially, the necessary time it takes to process the data, clean the data, make it ready for review and consumption by the public, we're starting with a base year of 2019. because that was the most recent data set available when we started our analysis. That 2019 American Community Survey data is compared against 2019 data that the transit providers in the region submitted to the National Transit Database. That allows us to make comparisons within the same year. We also have a horizon year to analyze the kind of long-term projections for transit demand in the region, and that horizon year is 2050. To produce that, the transit demand analysis under that horizon year of 2050, we're using population projections for each county within the region, and those county projections are prepared by the Georgia Governor's Office of Planning and Budget, which produces those projections on an annual basis for all counties through the year 2065. So based on all that demographic data, we produce an estimated rural trip demand and compare it against the existing number of rural transit trips provided by all transit providers within the Heart of Georgia region in 2019. So in 2019, transit providers provided about 86,000 trips across the region. And what we see is that under the non-program demand assessment, we estimate a rural transit trip demand of about 160,000. And under the mobility gap demand assessment, we estimate a total rural transit demand for the entire region of about 705,000. This means there's an unmet rural trip demand of about 75,000 under the non-program demand assessment and 619,000 under the mobility gap demand assessment. The final row in this table here shows the total annual costs necessary to meet that 100% of demand, and this captures both capital and operating costs. What this means is this is the total amount of spending that would be necessary to maintain and operate a transit network that was meeting 100% of that estimated rural transit demand. So in 2019, that amount is $3.2 million under the non-program demand assessment, and it's $13.8 million under the mobility gap demand assessment. Those numbers seem very large, and that's by design. What that is this is a kind of maximalist approach to estimate the full scope of transit demand within the region. It helps us understand just how much transit is wanted and how many additional resources would be necessary to sustain that. It's not a recommendation. This isn't what we're aiming for. It's just giving us a sense of the scope of the challenge. Now in 2050, we see a slight decline in rural transit demand. This is attributable to the fact that this region is projected to lose population between 2019 and 2050. So transit total rural and human services transportation demand decreases from 161,000 to 151,000 under the non-program demand assessment methodology, and it decreases from 705,000 to 697,000 under the mobility gap demand assessment. So the decrease is pretty low. There's still a pretty robust demand for transit within the region. And as a result, the total annual cost to meet 100% of that demand remain relatively similar to what they do in 2019. They decline slightly under the non-program demand assessment model to 3.1 million, and they increase slightly under the mobility gap demand assessment to 14 million. We'll go on to the next slide and touch briefly on the other type of transit demand assessment that we use under this methodology, which is commuter transit demand. And you'll see that this table is blank, and I'll explain why in just a minute. So the commuter transit demand assessment takes a slightly different approach to analyzing transit demand in rural areas, whereas the previous The previous analyses focus on transit demand within the county, thinking about every type of transit demand from, running errands and going to the grocery store to going to doctor's appointments to going to work. The commuter transit demand assessment looks at inter-county or cross-county trips within the region that essentially demonstrate the economic relationships between different counties, recognizing that some counties are going to be more, predominantly residential, more like bedroom communities. Some counties have large concentrations of economic activity, and that means that people would travel from one county to the other in order to go to work. The way this transit demand is estimated within the region is to use a proxy for transit demand, specifically the number of home-based work trips that occur within each county, essentially people who are working from home. We use home-based work trips as a proxy of transit demand because those essentially represent types of trips that are not being met by existing transportation services. It's essentially saying someone who works from home may want to go into the office, and we will treat that trip as an inter-county trip in order to get an estimate of transit demand. These home-based work trips are taken from a combination of sources, namely one managed by the U.S. Census Bureau and a set of data managed by GDOT directly using their travel demand model, which is a tool GDOT uses to estimate and analyze travel behavior and travel patterns in counties across the state. Now, the reason this table is blank for Heart of Georgia is that because we are assigning a threshold value to the number of transit trips that we feel is necessary in order to justify and sustain the costs of running a commuter transit service. And specifically, that number of trips is 100,000 trips per year. So while we recognize that there is inter-county travel within the heart of Georgia, that folks are going back and forth between these counties all the time, there isn't a level of demand high enough in any inter-county pairing to merit and justify the costs of running that inter-county transit service. So that's why this table is blank. I will pause there for a minute and just see if there are any initial questions or feedback or reactions to the quantitative components we've shared here.
Thanks, Barrett. Yeah, so anybody on the phone, please feel free to unmute yourself, ask questions, comments. There's a lot of numbers, a lot of data. So we want to make sure that what we're showing is very clear and understandable. You can enter questions or comments into the chat box. Alternatively, you can use the raise hand feature. If you think of something as we continue to go, please go ahead and raise your hand or enter it into the chat box. When we get to the end of the presentation, which we just have a couple slides left, we're going to open it up for discussion, and we can call on you at that time. So Baird, let's move on to the qualitative information we're hearing.
All right. So what we'd like to do now is share some of our findings from the qualitative elements, the provider survey and the rider survey that Matt mentioned earlier. We've been very happy with the responses we've gotten on these surveys. The reason why we've issued these surveys is to get kind of good, detailed feedback on the challenges and priorities and needs for rural and human services transportation, and get that feedback directly from our stakeholders. So we've got the provider survey to get that the perspective of those who are running the services, and then we have the rider survey to get the perspective of those who are using it or who might use it. So to start with the provider survey, we've received 36 responses to date. We're pleased with that level of response, but we certainly are looking for more. So if you have taken the survey already, thank you for your participation. If you haven't, it is open through the end of the month. And either way, whether you've taken it or not, we encourage you to share the survey with your peers and colleagues and encourage them to take it as well. But with the results we have so far, we've seen that slightly fewer than 50% of respondents are able to carry riders to destinations outside of their jurisdictional boundaries. And about 66% of respondents have not pursued coordinated human services transportation or regional transit service. We're not surprised by these responses. They're pretty consistent with our understanding of rural and human services transportation. A lot of these agencies are pretty small. They've got small administrative staff, and coordinating service across regions has a cost associated to it, an administrative cost, and providing the capacity to manage that service on an ongoing basis takes a lot of time, and it's not something that every agency has available. We noticed that many agencies reported less ridership in 2020 than in 2019. Specifically, 6 respondents had fewer than 5,000 trips in 2019, but this increased to 10 for 2020. Again, this is definitely something we've seen in transit really across the nation. It's a tough time for transit right now. Obviously, 2020 had, the tremendous impact on how people traveled, on where they could travel, with the loss of jobs, with shutdowns in hospitals and businesses. It meant that a lot of places where people would normally be traveling for regular appointments or regular trips were no longer available. And then tragically, of course, there's the loss of life that happened under COVID-19, where a lot of the ridership base for some of these agencies may have simply, gone away due to the impacts of the pandemic. So it's something we're trying to bear in mind as we think about those recommendations and strategies that Kirsten mentioned earlier, that essentially a lot of these transit agencies are starting on their back foot when it comes time to think about moving forward, that they're trying to recover those ridership losses and rebuild even to their pre-COVID levels. We did ask for input on what agencies were doing to prepare for their future. Namely, one of the questions we asked was what sort of technologies agencies are either currently using or planning to use. And the most interesting response to us was that while only 2 respondents indicated that they are currently using a smartphone app or website for trip planning and fare payment, 8 agencies are considering adopting this tool. We're glad to see that, glad to see this technology-centered thinking and thinking about how they're going to meet their customer needs. This sort of trip planning and fare payment options have definitely created a lot of value for riders in transit agencies around the country. We also asked about the most common challenges with state of good repair, and we heard an interesting mix here of kind of traditional rural and human services transportation issues, as well as more kind of contemporary and emerging issues. Namely, that the most common state of good repair need was purchasing new vehicles, which again, very common for rural and human services transportation agencies, that they have difficulties securing the vehicles that they need in order to maintain their service in a state of good repair. But the second highest issue was establishing regular maintenance schedules, because what we learned from these providers is that they often have to share their maintenance workers with other transit agencies in the region or with other county governments or municipal governments. And as a result, they're not able to conduct their maintenance when they want to, and instead have to schedule around, a limited supply of maintenance workers. What this means is it impacts their ability to have their vehicles repaired in time and get them back into service and maintain that reliable and consistent service that riders need. This overlaps with one of the main administrative challenges that we heard, which is attracting and retaining qualified personnel, which again overlaps with the comments we received earlier in this workshop, that there's just a lot of competition for labor right now, that people are struggling to maintain drivers, maintain mechanics, and they may have to be sharing these resources across a larger number of providers. In an earlier workshop, we heard that some transit providers are not just competing to keep their drivers with, kind of traditional expected competitors, other transit agencies or other agencies that hire drivers, but even fast food restaurants. That again, the COVID-19 workforce impacts have been so significant that fast food restaurants have lost enough workers that they're paying a lot more than they used to, and people realize they can make more money, slinging burgers and fries than driving for transit agencies. So it speaks to the real scope of this challenge. Our competition is coming from all different corners of the economy rather than just our traditional competitors. Additional administrative challenges were, again, the more kind of commonplace challenge for rural and human service transportation providers, which is compliance with state and federal reporting. Again, we recognize these are small agencies with small administrative staff, but they still have to, get those NTD reports. They still have to get their asset management data together for GDOT. It's a lot of different responsibilities to manage. We also asked for input on challenges related to rider demand and satisfaction and funding. With rider demand and satisfaction, we heard that the challenges were expanding service into new markets and ensuring that transit is able to go where people want it to go, and dealing with the public perception of transit, which again, we've we even heard earlier in this meeting that people often think that transit isn't for them. It's only for people with disabilities, or it's only for the elderly, but that's not necessarily the case. Transit can provide a wide array of needs for a wide array of people. And addressing that public perception is a significant challenge. More so, we're also dealing with, again, the fallout of COVID, which is that people see transit as unsafe. They think that being in an enclosed vehicle next to other people it represents a health risk to them. Obviously, the evidence has shown that that's not really the case. Transit vehicles can be very safe. Transit agencies have done a great job maintaining safe and clean environments for their riders and their drivers. And again, that's just something we need to recognize as part of the marketing and promotion challenges for transit agencies. The other area that we asked for input on, of course, was funding. Here again, the most common challenge for transit agencies was securing local capital funding, which again is definitely consistent with what we've heard in rural and human service transportation spaces across the country. A lot of these small providers are operating in small counties, small regions that have pretty lean governments running lean operations, and finding the money for those kinds of longer term capital investments can be very difficult. So again, we're pleased with the feedback that we've heard on these on the provider survey, but the survey is still open, and we encourage you to either take it or to share it with your colleagues and get them to take it as well. But for now, we'll move on to the rider survey, where we've received 55 responses to date. Again, we're very pleased with that level of response, but the survey is still open through the end of the month. We encourage you to share this survey with your constituents and get them to take it. What we've seen so far is that 85% of respondents indicate that they do not currently ride transit. Obviously, it's valuable to hear from people who do not use transit, because we want to understand what the challenges to using transit may be, or we want to understand what their perception of transit is, why they think they may not be able to use transit, or that using transit may not be of any value to them. But we also want to make sure that we are hearing from our current riders, so that we can make sure that transit is as efficient and reliable and consistent for them as possible. And so we'd definitely like to see that number get to more like a 50-50 split by the end of the survey period. Among those who ride transit, their main reason for riding is that they lack access to a vehicle, and their most common trip purposes are work, medical appointments, and dialysis appointments. So what leaps out there is obviously that transit is providing services for a wide variety of needs, and namely that a lot of those needs are pretty time sensitive. You know, we all need to get to work on time. We all need to get to our doctors on time. Dialysis appointments are scheduled pretty close together at these dialysis clinics. So we're dealing with fairly time-sensitive issues that will definitely kind of appear as a common theme throughout other responses in this survey. We did hear from these riders that if they were not able to use transit and they had to find an alternative, they would get a ride from a friend or a family member. That's very common in the rural and human services transportation space. People will tap their social networks in order to get the mobility that they need, and that's great. We're glad to see that people have options, but we know that working through friends and family is not always consistent. It's not always a seamless process, and it can create additional costs for those friends and family to provide those extra trips. And so we want to ensure that, again, transit is as reliable and consistent as it can be so that it can be a primary mode for people who would otherwise rely on, again, these kind of patchwork systems of friends and family. Among those who do not ride transit, their most common reasons for doing so are that they are interested, but transit is not convenient, or unfortunately that they are simply not interested. So again, we see that combination of making sure that transit is reliable and consistent, but also having to address the marketing and outreach challenges to build that awareness and build that enthusiasm for transit among their communities. The most frequently selected challenges among riders who use rural and human services transportation is that transit does not go where they want to go, distance to the nearest transit service is too far, and it's not reliable enough to use for time-sensitive trips. So we're seeing both the coverage challenges of ensuring that transit can go to many places throughout a county or even cross county lines, but then also is able to be reliable. It's able to provide a high level of on-time performance in order to meet those customer expectations and fulfill those time-sensitive needs. Along those lines, we asked riders to indicate, or I'm sorry, we asked all survey respondents to indicate what sort of transit improvements they want to see transit providers prioritize. And what we heard was providing access to jobs, providing access to healthcare, and connecting different parts of the community or region. So again, recognizing the need to meet both those time-sensitive trips for jobs and healthcare, while also expanding their coverage throughout the region and allowing for greater connectivity within that region. We also asked survey respondents to indicate what sort of transit technologies they want to see transit providers prioritize. And the two most significant technologies that they wanted to see prioritized were real-time arrival information at transit stops and real-time arrival information via smartphone, website, or text. So again, what we heard there, or what we see there is that riders want information about their transit service so that they can plan their trips most effectively and have that reliability and consistency with the information that allows them to trust in when that transit is arriving and plan around that service accordingly. So that concludes the qualitative section of the needs assessment. We'll turn it back over to Kirsten to open this up for discussion. But again, these surveys are open through the end of the month. We encourage you to take it. We encourage you to share it with your constituents. Thank you.
Thanks, Barry. Yeah, so that concludes the presentation portion of the workshop. We want to use the remaining time and use as much time as you would like to discuss transportation services in your area. As a reminder, if you're on the joining us through Teams, please use the raise hand function or the chat box function, and we will be happy to call on you. If you're calling in by phone, please feel free to unmute yourself and chime in with any questions or comments you may have. I have a series of questions for you all to kind of think about and provide some responses. But additionally, if you have comments or questions following this workshop, first of all, this workshop, a recording of it will be available on the GDOT website, as will a copy of the slides that are here today. And we are accepting additional comments and questions until March 4th, which is a week from this Friday. So there's still time to gather your input, but today is the most opportune time for you to speak up and tell us what is on your mind. So just thinking a little bit about the service areas and connections, I think we saw in this region that there are several counties that do not provide public transit services. That could be because the population that is in that county, it's hard to justify spending the money for a transit service. It could be political opposition to spending the money on transit service. But what I want to hear from you is, are there needs that you see in the region that are not being met? And are there missing connections? We didn't see a high enough demand for a commuter service necessarily, but we do know that there is inter-county trips that are being made either within your region or from your region maybe to an adjacent region. So any gaps in service, missing connections, places that you wish transportation services would go that aren't currently going? No, everybody's fine in heart of Georgia, huh? Keep thinking about that. Um, your region is adjacent to several other regions where there may be services that are needed, medical appointments, especially that's something that we heard from River Valley when we did their workshop yesterday, is that they have a real need to have better connections to Atlanta because Columbus, while they have good hospitals, they don't necessarily provide the specialized services that all of their patients need. And so they have to travel up to Atlanta to get the care that their patients need. And what they're finding is that because of driver shortages, transportation providers are actually canceling the trips on the patients getting up to Atlanta. So finding those long trip providers has been a real challenge for them. So I'm curious if y'all have seen similar trends in the heart of Georgia. I'm going to keep going with questions. I've got more, so keep thinking. We really, really want your input. So any comments or questions you have would be greatly appreciated. These next series of questions is about coordinated service. And first of all, I'm just curious how applicable this is to heart of Georgia, and if there have been any conversations or there's been any push to coordinate among counties, or if there's coordination between the public transit providers and DHS. And if there is not interest in coordination, what is driving that? Is it that each county just feels like they need to operate their own services? Is it the cost for coordination may be too high for the county governments to be able to cover?
We really like to hear from our guests. This is Jaquetta. Carolyn, I know you're our guest. We want to hear from you. And then what about Melissa? And then we also have our folks on the phone. Feel free, or I can unmute you if you want to chime in right here. This would be a perfect spot. not to put you on the, not to put you on the spot, Carolyn or Melissa, but kind of, sorta.
We just want to make sure that we're hearing the needs from all of the regions, and that, you know, whatever our recommendations are in this plan are applicable to all of the counties across the state, not just certain regions. And that's why it's really important that we hear from you and your challenges, because they may be different than other parts of Georgia. And we want to make sure that we have solutions that address your needs too. So again, you can email your comments and questions as well following this meeting. You can share a recording of this meeting. All of those will be posted after the workshops conclude. Our last workshop is tomorrow afternoon. And then all of them will be posted on the website. We're going to show you and tell you the website link. A couple other questions to kind of think about that will really help us is kind of on the administrative side. Are there administrative operating needs? I think we heard that there's driver shortages, that we need more money to pay more competitive compensation to drivers and probably other employees of these services. Curious if, you know, the cost to the rider you feel is preventing higher riderships. Are you having to increase your fare costs to cover your operating and maintenance costs? And are you starting to see a decline in ridership? And finally, the kind of end all be all question. If you had $1 million just fell into your lap and you could spend it any way you wanted on your transportation service, where would you put that money? How would you spend it? That'll really help us kind of prioritize these programs and projects and policies that we're going to be thinking about, and making sure that we find funding sources that match those solutions. So we know funding is a big issue for everybody. So keep thinking about it. Still time to put it into the comment box. Raise your hand. I'm going to hand it back over to Matt to finish out a couple slides.
Thank you so much. Thank you, Baird. And this is not the last time we'll ask for comments, so you can always email us a question. My contact information will be on the last slide here, or email Kirsten and with a question or your comments. So this also will be posted on our website again. So if you do think of something, please let us know. You know, this is we need to hear from you. We need to understand needs in your region. Nobody understands them better than those who live there. So we want to make sure that the information that we have and your needs are addressed through this plan. So just to review our schedule one more time. We are working on the existing conditions assessment. This is the information that will go into that assessment, and also the alternatives analysis. And then we will start the development of the draft final report in the coming months. We are targeting July for publishing the draft final report, and that will be on our website for that public comment review period for you to review. Once again, I want to say thank you so much for your participation this morning in the workshop. Again, don't hesitate to reach out to myself or to Kirsten with any questions or comments on the information we shared today. Also, please, if you haven't done so, complete our survey and share it out with those that you know who might be interested in these services as well. If you're on the phone, the survey is at www.dot.ga.gov/transit, and my email is mawilson@dot.ga.gov. And we ask that if you do have any questions or comments, please send them by March 4th. That allows us time to respond and capture those comments for this meeting summary. So with that, I want to thank you again for your time this morning, and have a great day. Thanks so much.
Thanks, everybody.